the Section 2 part of the Year 11 preliminary final exam for 2011 involved two questions, both made up of Part A and Part B, Part C. I just want to make a comment firstly about several students obviously didn't read the instructions about how much time to allow. It's very clear that 15 minutes it needed to be allotted for this section at least. The fact that some students didn't get their answers completed, or it appeared that they didn't get their answers completed, meant that the time wasn't used effectively. So that's a tip for going forward. Make sure you read these rubrics and the instructions that are given there. If you look at question 24, it's 15 marks, and part A was to describe the procedures that reduce the risk of contact with body fluids in first aid settings. It was a 3-mark question. If we have a look at the syllabus, the part of the syllabus that this question came from was, if we have a look here, the section here, infection control, protection, HIV/AIDS, blood-borne viruses, describe the procedures taken to reduce the risk of contact with body fluids in the event of contact with body fluids in first aid settings. So that's the dot point that it comes from. To describe is to show the features of. So when we're looking at the description, we needed to do that in reference to the body fluids. Now, some examples of some strong questions, strong answers, I should say, that demonstrated what we were looking for there. First of these, there are a few elements that we needed to incorporate. Gloves needed to be in your answer, which most people were able to refer to. The use of a face mark in using CPR was another thing that you need to incorporate into your answer. One that was missed by quite a few people was washing of hands, so before and after that, and then the control of the contaminated fluids. So if we look at this answer, use of the highlighter, the use of gloves is evident there, reduces the risk of body fluids being transferred. Cleaning the surface, looking at the body fluids there. Warm soapy water refers to the cleaning, the resuscitation mark, and then to prevent the transmission, such as the disposal of that particular bodily fluids there. If we look at another example for this particular section, the underlining, first thing that you'll notice is the underlining. Blood-borne viruses, Hep C and HIV were mentioned there. The use of a face mask, plastic sealed bag containing or controlling of the infected fluids, and the plastic or disposable gloves. So that's another good example there that covered all those aspects of the answer. If we look at the third example, again, and notice with all these, the use of the highlighter makes it very clear to the marker what we're talking about in their answer. Latex gloves, face mask, protective clothing, obvious there to the marker without having to read through the question. Even though that happens, it's made obvious to the marker. Cleaning of the person, could use your shirt. That's a good initiative there, and use of gloves. Then the other thing that was mentioned with the performing of CPR, when in the recovery position and clearing the airway, some students mentioned, which was a good point, that the casualty should be rolled away from the first aider. 24B, explain the assessment and management procedures for responding to an emergency. So we need to go through the process or the plans that would be in place for this. Again, if we have a look at the part of the syllabus that it comes from, and we see here that dot point, the first dot point in first aid, settings for priorities for managing first aid situation, assessing the casualty, situational analysis, priority assessment procedures, DRABCD, and we understand that there's an S in there after the A and before after the R and before the C, the response in the airway for send now. That's an important thing that we've learnt through our first aid procedures. And then the stop procedure, the stop, talk, observe, prevent further injury, which in some too many cases that was not incorporated into the answer. If we have a look at a couple of sample answers. First one, again, first thing you'll notice is the use of the highlighter. Started off with DRABC, then talks or explains each of those, so it tells us what it means, and going through each one of those, which again some students fail to do that. Many of you just put the acronym and then didn't explain or tell us what those were about. So that's very clear that each of those elements of the acronym are carried out. This answer continues. Again, the compressions defibrillator have been incorporated very well into the answer there. So good explanation. 30 compressions talks to us about how deep with the compressions need to be as well. Another example. Again, this student has looked at the situation analysis, what has happened, gone through the dangers, and then each of the steps of the emergency procedure, included stop there, as I said, which many students fail to do. Talk, tell us what that stop procedure is. Continues through the answer, doing the primary and the secondary survey, looking at the signs of life, finishing with the recovery position. So again, a strong answer there. The third and final part of question 24 was part C, discuss the legal and moral dilemmas associated with providing first aid. Two parts to this question. So discussion, you need to examine the points surrounding both the legal and the moral dilemmas, giving us a definition of those. We see where that has come from. See, it's this particular dot point here. The second last dot point in the first aid section. So you would hopefully be able to refer to maybe some legislation or laws that are in place, moral obligations of the duty of care, common sense versus heroics, which many of you did quite well. If we have a look at a couple of strong answers who did well in this particular section. Again, you'll notice that underlining, highlighter, and just a tip for everyone again, that everything that you write on your page will be read by the examiner, so it's okay to use things like an arrow if you've forgotten things, or to plan out your answer. That'll actually assist you with your marks. Here we've given us a grounding point where we've spoken about that it's a legal dilemma, plus we move into looking at moral dilemmas that are judgment calls that students need to make, that first aiders need to make. We can see here the discussion of the Good Samaritan Act, which is evidence of legislation or an understanding of the legislation that's in place in New South Wales that assists the first aider. The answer continues on. Here we go into so they've completed the legal dilemmas and made good reference to that with accurate statements. Good use of correct terminology, moral dilemmas we've spoken about now, and the information regarding this section lets us understand that it's an individual thing where you will need to make that judgment based on where you stand. So this answer is a clear one. I like how they've structured the moral and the legal dilemmas in two different sections and used correct terminology, and have been able to discuss the Good Samaritan Act, which is evidence of the moral dilemmas, the legal side of things in New South Wales. Look at another response. Legal here underlined. It gives us a good starting point where we can go. The discussion of duty of care, one of the key terms that should have been discussed. Negligence was possibly another area that could have been discussed and should have been discussed. Consent, and the availability or the responsibility to perform a record or recording of the actions that has been taken by the first aider. So this answer's moved from the legal side of things into the moral aspect of their discussion, and talking about the feelings that they may have, their morals or their value system that would be in place for them to be able to carry out the responsibilities of the first aider. So what we're looking at, really important that you use correct terminology, structure your answer. So in this particular case, talk about the legal aspect of the question, then the moral side of it, and backing up with what you're saying with correct terminology. And those answers we've displayed have been some of the top end responses.